Right, from Patrick Falk, now let's cross to our reporter Neha Poonia in New Delhi in India for an update. Well, good afternoon to you. There's been disappointment here in South Africa after it was announced that the vaccination will be on hold due to its efficacy. So what's the reaction in India?
Well, we haven't heard officially from the Indian government or from the Serum Institute yet, but sources in the government have told me that they're aware of the development and they're keeping a close eye on what happened, and they will, if need be, comment in the days ahead. The source in the government also told me that they're not getting involved just yet because this was a commercial agreement. It was signed between the government of South Africa and the Serum Institute of India. So it was a government and a company agreement and has nothing to do with them. I've also reached out to the Serum Institute and they've declined to comment on this particular issue yet. Instead, they've said that they are keeping an eye on this and they cannot issue a comment just yet. But we're given to understand that there is some sort of communication happening between the firm and the South African government. Details of that have not been made public yet. But also a sense of disappointment here in India as well. South Africa is an old ally of the country. Many people expressing shock that this has happened to a country that has been as badly hit as South Africa. Many saying this is also a lesson for many other countries, including India, which is also launched what is the world's largest COVID-19 vaccination drive and is also using the Oxford AstraZeneca jab on the ground. Some people saying they're hoping these vaccines will not go to waste and South Africa will still be able to use them at least to prevent severe cases of COVID-19, but certainly something that a lot of people are keeping a close watch on here in the country as well. Right,
so the expiry date is being questioned there. Is there any explanation given why South Africa had to receive a vaccine the dates that were actually very closer to expiry?
Well, this was one of the queries that I specifically put to the representative of the Serum Institute of India, given what's being discussed in South Africa. And I was told that they will not comment on this, but a source told me that it's quite unlikely that these doses were close to expiry. I'm given to understand through reports and through other sources that this is one of the issues that the South African government is currently discussing with the Pune-based firm, which is a company which is the world's largest vaccine manufacturer by volume and has also been leading really the vaccination drive efforts here in the country as well. Some experts have told me that there might have been some sort of crossed wires on the vaccination expiry date, and that currently South Africa will try to either see if there's an extension that's possible on this batch of doses, or if this stock can be replaced with another batch of vaccines as well. But the company has not commented yet, and experts have also told me that most COVID-19 vaccines are usually viable for a 6-month period. It's also important to understand that the Serum Institute has been bulk producing COVID-19 vaccines, going back a few months. They were doing this in anticipation of emergency authorization coming through, not just from India, but from countries like South Africa. And they had bulk produced to keep in mind that they would be able to meet the demand that was coming through many countries. And doctors also point out that, this vaccine batch had arrived in South Africa a few weeks ago, and the idea was to roll it out this week. So in that sense, this vaccine batch would have already been completely utilized before it reached expiry date, if in fact April is the expiry of this particular batch of COVID-19 vaccines. There's no clarity on that yet, no confirmation from the company.
Well, Neha, reputation matters will come to the fore. So one would wonder what will happen to India's reputation as a vaccine manufacturing country. And one would wonder if there was a direct negotiation from country to country between South Africa and India, or was there a middleman?
From what I understand, this was a commercial agreement, which means it was directly signed between the South African government and the Serum Institute of India. My source in the Foreign Ministry also confirmed this, saying that the government had nothing to do with it. It was not a go-between as far as these two entities are concerned, which is why it was not a government-to-government deal at all, which we've seen India sign with several other countries in South Asia. But, when you talk about the question of what this means for India's reputation as the pharmacy of the world, it's something that Prime Minister Modi has constantly touted. India has already exported vaccines to many low-income countries to help them get their own vaccination programs underway. This is especially important at a time when many Western countries have been accused of hoarding vaccines and not sharing them with countries that are worse off as far as this pandemic is concerned. And India has reiterated that its offer to help, its offer to get countries get their own vaccination drives underway does not end here. India is importantly developing many more made in India vaccines. It's also manufacturing the Sputnik vaccine here. It's also in talks with Johnson & Johnson. So my sources in the government tell me that whenever there is any question of helping a country like South Africa or any other country in the continent, India will do whatever it can. It's not turned down any offer from any country to help them out as far as dealing with this pandemic is concerned. So India is hoping this is just a blip. It's a fight that many other countries will have to fight in the days ahead, as well as we see more COVID-19 mutations crop up in different parts of the world, given how patchy the vaccine rollout has been. But India is hoping that this does not mean that its reputation as the pharmacy of the world, a country that manufactures 60% of the world's vaccines, will take any sort of hit, because it's still committed, to its message of solidarity with other countries.
Right. Thank you so much for the update. Coming to us live from New Delhi in India, it's our correspondent, Neha Poonia.